The family nurse practitioner asks a patient to perform rapid alternating movements of the hands to evaluate A. Cerebellar functioning, B. Cognitive functioning, C. Reflex arc functioning, D. Stereognostic functioning. Got it? Let's move on. After determining that a 2.5-year-old patient has a lead level of 16 msg/dL, the family nurse practitioner A. advises the parent to avoid giving the patient bottles of whole milk. B. consults with a physical therapist for muscle strengthening. C. orders an increase of iron supplements to 6 milligrams per kilogram per day, divided in 2 doses. D. repeats a blood test within 1 week to 1 month. Safety first. A 38-year-old patient who is Vietnamese tells the family nurse practitioner that their parent died in their 40s from liver cancer. The nurse practitioner assesses that the patient is at risk for A. hepatitis B, B. malaria, C. tularemia, D. tyrosinemia. Think. Hepatitis B risk. A 40-year-old patient has had a generalized non-pruritic skin eruption with intermittent exacerbations over the past 10 years. Currently, a well-circumscribed erythematous plaque appears over the patient's left gluteal fold area. The lesion is covered with scales and has some fissuring. The family nurse practitioner makes a diagnosis of A. atopic dermatitis, B. ichthyosis, C. psoriasis, D. tinea corporis. When it comes to occupational disease, the long latency period between exposure and disease development is a tricky aspect. A patient who had a total gastrectomy 1 year ago reports a sore mouth, indigestion, and tingling in the lower extremities. Which test does the family nurse practitioner order? A. blood urea nitrogen level, B. complete blood count, C. liver function study, D. thyroid function study. Order a complete blood count. A 42-year-old patient with epistaxis, dilated pupils, tachycardia, and mild euphoria shows symptoms associated with the use of A. alprazolam, Xanax, B. cocaine, C. morphine sulfate, MS-Contin, D. oxycodone hydrochloride, OxyContin. Cocaine use is your suspect. During cardiac auscultation, a soft first heart sound with a hollow systolic apical murmur that radiates to the left, axilla suggests A. aortic stenosis, B. mitral regurgitation, C. mitral stenosis, D. mitral valve prolapse. A patient who sustained a myocardial infarction comes to the clinic for a refill of atorvastatin calcium, Lipitor. The family nurse practitioner recognizes that the medication is prescribed for A. cancer prevention, B. primary prevention, C. secondary prevention, D. tertiary prevention. It's for secondary prevention. A 2-month-old patient has a strawberry hemangioma 2 centimeters in diameter on the left buttock. When speaking with the patient's parents, the family nurse practitioner, AA, advises that the lesion should spontaneously resolve. B. asks about any history of gestational diabetes. C. investigates any family history of skin disorders. D. refers the patient to a dermatologist. Advise the parents it should spontaneously resolve. Keep these questions in mind, and you'll be 1 step closer to FNP success. Don't forget to hit that subscribe button for more tips and tricks. Happy studying!